Research by the Health Foundation suggests the health service in Wales could be facing a £700 million black hole in just over 3 years' time. Anita Charlesworth is from the think tank. She told BBC Wales some of the pressures on the Welsh NHS.
Wales is going through a period where the population is ageing. The numbers over 65 are going to grow by about almost 30% over the next 15 years. If we age well, that's one thing, but lots of those people have got a burden of chronic disease, and making sure that they're able to stay well and be well supported in their homes and in their communities will be really important for the outlook for the NHS.
Well, the shortfall would be equivalent to more than 10% of what the Welsh NHS currently spends in an entire year. The Health Secretary, Vaughan Gething, gave BBC Wales this response to the report's findings.
Well, we've already made clear that the funding gap that's been identified will be filled, and the challenge now, and you'll see in this budget and future budgets here, is whether we can match that commitment. We've been really clear about our position. That's why over the last 3 years health spending has gone up by 14%. So we've met that financial challenge in the short term.
So how can health boards look to close the gap, and what might the added pressures mean for staff and patients as well? Vanessa Young is director of the Welsh NHS Confederation, the membership body representing the 7 local health boards and 3 NHS trusts in Wales. Good morning.
Morning, Gareth.
Vaughan Gething is saying there that at least in the short term, the next 3 years, there isn't any great problem. Would you agree with that?
I think that over the next 3 years, the report identifies a £700 million gap by 2019-20, and I think at over 10% of the revenue budget, that is going to be a significant challenge for our members. The report does put forward some proposals about how that can be met, both in terms of increased efficiency and pay constraint, but those things are not without risk.
So is the short-term future, not even come on to the long term yet, the short-term future rosy from your point of view? Are there fundamental challenges that the Welsh NHS is facing?
There are fundamental challenges. The report talks about both the long-term and the sort of medium-term. The long-term prospects look more promising, but it is dependent upon government being able to commit to put in growth into the health budget in line with economic growth over the next 15 years, year on year.
So more promising, but dependent purely on the amount of money that's invested in the first place?
Yes, indeed, and keeping pace with economic growth. But the challenge is very concerning for the next 3 years in particular, and that's because pay represents about over 50% of the NHS's revenue spending. So if there is any change in the pay constraint assumption, then that could have a significant additional impact on the challenge that we're facing.
And the report does mention, doesn't it, that if pay rises were to be capped at 1% for the next 3 years, if there were efficiency savings of 1.5%, then some of this shortfall could be addressed. It looks easy on paper. Are those easy things to implement, though, in practice?
No, the workforce is the biggest challenge for our members. We're seeing recruitment and retention difficulties right across Wales, and in particular places, particularly in rural areas. This week alone, there were over 600 job vacancies published on the NHS Wales website, and they're challenges that we are seeking to address right now. But the consequences of those recruitment and retention issues are that we are having to spend more on agency costs, for example, and we're seeing those costs rising. So the immediate challenges facing the workforce are such that it may be difficult for us to be able to hold that pay constraint for that full 3-year period.
These are not problems peculiar to Wales, though, are they, in terms of recruitment and retention?
No, but some of them are heightened in parts of Wales due to geography, and the issue is about some decisions that we've taken in the past during the period of austerity, for example, around the number of people that we're training. And so we're feeling the effects of decisions that were taken perhaps back in 2008, 2009, where training numbers were reduced, and that means that we have less medically professional qualified people now, and that's why we're facing some of the pressures that we are.
In terms of patients, split this into 2 categories as well, the short term, the next 3 years, and then longer term as well. What, if any, changes are we likely to see as patients in the next 3 years, first of all?
At the moment, the NHS is struggling to cope with the demands that we are seeing, and we have on this programme talked before about winter pressures, for example. So there is already significant pressure on the system to keep up with the demand.
So longer waiting times are a potential consequence then?
In terms of the longer term, Anita Charlesworth in your earlier piece referred to the ageing demographic and the number of people over 65 that we will be seeing in the next 15 years, a rise of nearly, I think, 28%. And with that comes additional challenges, because as people are ageing, they often have complex conditions which require more support from the NHS. What we are aiming and trying to do, working with our partners, is to shift services from hospitals into communities, so that we are working together, particularly with our colleagues in local authorities, but also the third sector, to keep people well and keep people independent longer. And the report does make reference to the need for us to do that, to stem the demand on the acute sector.
And very briefly, if you can, how confident are you that the NHS in the future is going to look the same as it does now? People can expect the same level of standard care and service?
I think it's always going to be a challenge, because there's not an unlimited pot of money. What the report says is that these assumptions of the 700 million relate to maintaining the current range and level of services, and we know that there's unmet demand already. So the challenge is going to be, how do we make the best of the resources that are available to us? And that requires a commitment from government, our partners and the public to work with us to try and make the best of the NHS and the services we provide.
Thank you for your time this morning. Good to speak to you. That's Vanessa Young, who's Director of the Welsh NHS Confederation. It's 14 minutes past 8.
Well, let's talk about the story that's got you all talking this morning then. Dozens of the UK's favourite brands are unavailable from the country's